Okay. Hello, this is Dr. Abhineet Mehrotra. I am basically MBBS with the MSc and PhD in medical microbiology. I did my MBBS way back in year 2001, and afterwards I did MSc and PhD. Uh, I have almost 10 years of experience, teaching experience in microbiology uh, in different medical colleges, and I think I feel great uh, for teaching this field. Thank you. Well, what inspired me is that uh, I have a feeling of giving something back to society. I have a feeling that I should work for the betterment of society, which leads me to follow this profession. And this profession allows me to fulfill uh, my work, my ambition to contribute to the society. Well, most rewarding for me is feedback which I get from the patients, feedback which I get from persons, from my colleagues, from the persons who are working under me also. And as such, I find that I'm fulfilling my dream of contributing something for the society. So I find this very much a way to help a society as a whole. So this profession is a very rewarding one. Uh, and as a medical faculty, I feel that I contribute uh, certain amount to make medical students a good doctor. Well, there was a lot of challenges actually at all levels, uh, so related to academic, as Medical Council of India and even now NMC have brought forth many different parameters for the persons to qualify as a teacher, medical teacher. So, getting along with all that and fulfilling all the parameters, all the things whatever is needed uh, by the main authority, that is Medical Council of India or NMC, and getting to it and qualifying for being a medical faculty was a big challenge for me, and still it is because rules are still kept on changing. So that profession is actually teaching profession is a relatively very challenging one. Well, my specialty is microbiology. I choose microbiology because it has good role in medicine, because when any person uh, when any patient comes to a doctor, most of the times in India, that person suffers from directly or indirectly from a infection disease, and knowledge of microbiology will leads to the application of diagnosing an infectious disease and giving treatment for this. So I like this profession, this specialty very much for the same reason. Well, there's a lot of things have been changed. Lot of uh, things have been, but there's no change in empathy, I think so. If a person who's treating or and diagnosing the disease is empathetic, then half of the battle is won. And how to second is how do you treat? And so there's a lot of things which have changed in the medical faculty, in the medical field. Suppose earlier the treatments were there, limited treatments are there. Now treatments are of various types. Earlier the diagnoses were made basically on clinical aspects. Now we have different uh, lab diagnosis instruments which perform different tests, and more specific and sensitive tests are now performed, which earlier was not there. So a lot of things have changed, and apart from that, there's digital age as well. So a lot of things are now done by a person who's not at the place where the things are going on. It's remotely being done, like in what is happening in telemedicine, and also what is happening in robotic surgery. So quite a lot changes are there. Well, I would like to give an advice that first you have to be very much what do you call empathetic, and very much committed to work for the betterment of the society. Because if you are not there, or if you are going only for getting fame or money, there are other fields where you can achieve that. Because somewhere down the this career, you might have some patients, or you might have some persons who want your help, but they cannot offer you the fame, or cannot offer you the money. And then the onus lies on you whether you want to uh, treat that person, whether you want to and uh, be with that person to to help him to solve the problem which he or she is suffering from or not. So I think that the best advice for me is that first of all you have to be very empathetic, very sympathetic towards your patients for that purpose. And secondly, you have to be very hardworking also. Otherwise, if you are only conscious, if you are anxious about their health, but you are not hardworking, that remains uh, an incomplete objective. So you have to be very hardworking, very much committed to work for the patients and for betterment of the society. Well, who's new, again the same thing is there. Most of the thing is that you have to be very committed to your patients. You have to be very committed to for the betterment of the society, and yes, of course, hardworking. And without that, it's not possible. Because at young age, as much as you can work, it'll then only you can reap more in the older age, in the middle age and the older age. Otherwise, if you have not worked well, if you've not worked hard during your early years, you are bound to suffer. You might end up being frustrated. You might end up not liking your job. So better is to be, what do you call, embedded, be there, be more with the system, and engrossed with it, with the whole system, and work really really hard for the betterment of the society. Well, I've already told that significant changes are there, and significant changes are for the betterment in the field of treatment. But there's also fear which has led, like we have, for example, antibiotic resistance coming up for in the line of treatment. So it is really a very very horrifying thing to happen in future if most of the antibiotic comes out to be resistant. Will not land up with any sort of treatment. So it is better to use with discretion the antibiotics. I want to stress upon it, and follow antibiotic stewardship program. So this is one of the examples, and others is more of a digital, more of a things which we can do in advancement of the lab diagnosis, we should go for it. And there are research going on still in many different fields of medicine, and I hope we will try to overcome most of the things. As you can see, we have overcome with the pandemic which recently had happened, although the virus is still there, it has not gone, but most of the percentage we are able to achieve what we wanted to, so that the society do not live in fear, the whole world do not live in fears. And we have watched, and we want to, I think more is more on the investment of the on the research, so that we can discover new and new techniques to overcome the diseases which are at present challenging for the humankind, for the mankind. Thank you. Well, I think I have shared most of the things, and apart from that, uh, through my teachings, I would like to contribute more for the betterment of medical and paramedical students, so that they becomes more and more good by profession.